Good afternoon. This is Dr. Dale Bratzler. I am the Enterprise Chief Quality Officer for OU Medicine and also the University Chief COVID Officer here at University of Oklahoma. So let me just give you a quick update of some of the data that we have accumulated this week over the past 7 days. So right now, as of today, we're at 34,623 new cases with a total of 523 deaths. Sadly, there were 14 more deaths that were reported today, and I noticed that 4 of them were in the 50 to 64-year-old age group. The rest of them were 65 years of age and older. Just within the past 7 days, we've seen just over 6,500 new cases confirmed in the state of Oklahoma, and right now, if you look at the 7-day rolling average of cases in Oklahoma, we're at 937 cases on average each day. Let me just switch to talking about testing just a little bit. On Monday, the State Health Department provided the results of 22,092 different tests, of which 13.5% were positive. That's a new high. I've never seen the state number get up to 13.5%. Today, they resulted in another 17,925 tests, and of those, 7.7% of the tests were positive. So over the past couple of weeks, we've seen rates that have been fluctuating right around 10% of all tests are positive. As of yesterday, there were 663 people in the hospital, 530 of those people with a confirmed test or positive disease, and of those, 40% of the patients were in the intensive care unit. So that's where we're at with numbers right now. The other thing I wanted to do today was highlight a couple of studies that got published this week that I think are very, very important when we think about what are the potential long-term or longer-term consequences if you get this infection. So the first study came out from the CDC. It was published in the MMWR journal, and they surveyed a bunch of patients who had symptomatic disease, so that's important. These were all patients who had symptomatic disease, and 35% of the patients reported that at 2 to 3 weeks after their positive test, they were not back to normal. The most common symptoms that they continued to have was cough and fatigue. And even in that 18 to 34-year-old age group, the younger people who had no comorbid conditions, were otherwise healthy, 1 out of 5 of them reported continuing symptoms more than 2 to 3 weeks after they had their initial test done. So again, it highlighted there were a long list of complications and side effects and symptoms that these patients had, and it just simply highlighted that a lot of people will have ongoing symptoms that may last for longer periods of time beyond that time frame that the State Health Department defines as recovered. The second study was an interesting one that came out of Europe that looked at patients who had, again, symptomatic COVID-19. They looked at 100 patients, and they did cardiac MRI, the magnetic resonance imaging test, on the heart of all the patients. 78% of the patients had some evidence of heart inflammation from the virus. And so it's a side effect that we've known about. If we do certain blood tests on patients who have COVID-19, we often find out that they have some inflammation of the heart. Chest pain and cardiac symptoms are not uncommon in patients who have COVID-19. So that's the update this week, and I just wanted to highlight those 2 studies that show that just because you've, quote, recovered, doesn't mean you don't have symptoms that last for some period of time afterwards.
That is really interesting. All right, we have several questions today. First one, let's talk a little bit about forehead thermometers versus the traditional under-the-tongue ones. Pros, cons?
Well, I think, a lot of times in places that are doing screening of temperature, when patients come into a building or things like that, they're using the forehead or the ones that what we call touchless thermometers. I don't think they're quite as accurate as the mercury thermometers that you put under your tongue, but they're touchless. And so one thing we're trying to avoid is getting too close or going direct contact with people who could be potentially infected with COVID-19. So I think for home use, either one of them is fine. Just remember that the reason that in many of those settings where they're doing The touchless thermometer is just to protect the healthcare worker so they're not actually touching the person who could be infected.
So at home, you wouldn't really have a reason not to use the under-the-tongue traditional one, it'd be more accurate anyway.
Yeah, using the under the tongue, the mercury thermometer is quite safe. You just need to remember to clean it with alcohol after you use it. Obviously, never share it between individuals. If you ever have to do that, you need to clean it with at least 70% alcohol, isopropyl alcohol.
Okay. Is there a reason that people should I be checking my temperature at home every morning?
Yeah, so I'm not a huge fan of using temperature alone as a screening tool for COVID-19. Remember that more than 50% of the people, even when they're sick enough to be admitted to the hospital with COVID-19, don't have a fever. So it's one symptom that can make you alert you that you could be infected, and so there's nothing wrong with doing it, but if your temperature is normal, it does not mean that you're not infected.
Okay, the OKC mask mandate has been in effect for over a week now. In your opinion, is the mask ordinance making a difference? When can we expect to see the number of people testing positive go down?
So let me answer it two different ways. For Oklahoma City, I think it's too early to know for sure, because when you look at the testing data that's coming out from the state health department, it's very likely that a lot of the tests that we're seeing now, the results of, happened a week ago anyway. So I think I always predicted it would take at least 2 weeks from the date of an ordinance before we might see some reflection of improvement in actual data. One of my colleagues, Dr. David Kendrick, that runs the My Health Network over in Tulsa, he's one of the professors over at the Tulsa campus, has a rich data set that captures data on when tests are done and whether they're positive or negative. And what he has shown very preliminarily is that when cities have passed ordinances, he started to be able to demonstrate that their percent of tests that are positive has started trending down as compared to communities that have not implemented masking policies where that trend has been still going up. So the percent positive test. Still way too early to know for sure. He has very preliminary data, and that's what we're working on now.
So I would think it'd be kind of an additional positive that now some of the suburb areas like Midwest City, I think, just passed an ordinance, and did Edmond as well. So as we're starting to see the surrounding areas, that's just going to help in general, right?
Yeah, I hope so. So one of my colleagues, Dr. Craig Rice, down on our Norman campus he's the medical director for the Student Health Center, Goddard Health Center in Norman. And we do about 200 or 300 tests per week out of that center. 3 to 4 weeks ago, about 12% of the tests that we were doing were positive. We implemented a policy at the University of Oklahoma for all of our buildings with a mask policy, and then the city of Norman also implemented a policy, and Dr. Rice has seen the percent of positive tests drop. It went back up a little bit this past week, but it's still dropped substantially from where it was at 12% before. Last week it had actually gotten down to less than 5%. So I think the first indicator that we will see that masking policies are starting to help is when we see the percent of positive tests start to go down.
Any new trends with the virus that you're seeing that you haven't already talked about?
The virus remains very, very contagious, still being spread principally at this time by younger individuals, 18 to 35-year-olds. But one thing that our team here has noticed is as we've seen more and more cases in the 18 to 35-year-old age group, we've also seen the number of patients 65 and older who have also tested positive. And again, when you look at the deaths in Oklahoma, the vast majority are in patients that are 65 years of age and older, and I suspect that many of those people in that age group who get infected have been exposed by younger people that may be more social or mobile out in the community setting.
What do we know about COVID that we did not know at the beginning, and things like incubation period symptoms when it's most contagious?
Yeah, so a couple of things that I think are much clearer now. One is the route of transmission. When we first started talking about COVID-19, we assumed that transmission was just like influenza or other respiratory viruses, and for the most part it is, but we know now that the principal mode of transmission is respiratory droplets. So when I talk, droplets come out of my mouth, and if somebody's close to me, they can inhale those droplets. We also know that there is limited evidence about aerosols, the finer particles that come out of somebody's mouth that can travel longer distances, and that's one where there's still debate about how much it contributes to infection. The CDC has much downplayed the role of touching contaminated surfaces and then touching your eyes. It's not to say it can't happen, but that doesn't appear to be the principal mode of transmission. Patients are typically, if they have symptoms, are typically symptomatic from about 2 days before they have symptoms. So we know that you can start spreading the infection even before you know you are infected. So that's very, very important. And then with respect to the symptoms, remember the 3 big ones that we talked about all the time before, back in March when we had our media event. We talked about fever, cough, shortness of breath, but now we know GI symptoms, diarrhea, nausea, headaches, loss of taste and smell can all be common presenting symptoms. Loss of taste and smell is an interesting one because we see it often, more often in younger people who get the infection. So there are a host of symptoms that can occur that we just didn't recognize before. And then finally, I think that's why I highlighted the 2 studies early today. We know that some people, when they get infected, will have prolonged symptoms for some longer period of time, even though they may not be infectious anymore and have been deemed recovered from the infection.
Kenneth Akey was asking if the increase in positive tests, if it was due to increased testing or increased community spread, and what would be the cause of community spread?
So when you see a higher percent positive test rate, that means there is community spread of the virus. In other words, more people are infected, therefore more specimens tested are actually positive. So it is true in Oklahoma now, particularly over the last few weeks, we've seen a fairly dramatic increase in the number of tests done, and there's big demand to get tests because a lot of people are calling these centers and asking to get tests done. But remember, May 25th, the week of May 25th, of all the tests that were done that week, only 1.8% of the tests that were run were actually positive. But this past week, 10% of the tests that were done were positive. And again, on Monday of this week, there were a lot of tests. I think 27,000 tests that were reported on Monday. Of those tests, 13.5% were positive. That simply means we tested more people who were infected.
Okay, are we doing enough for contact tracing?
Well, I know the state health department and the city county health departments are doing the best they can, but when you have 1,000 new cases a day, it's very, very difficult for any county or city, or state health department to keep up with that volume of people to do adequate contact tracing. And there are a couple of things that have happened. Number one, there's been a delay between when the test is done, it's reported positive, and then when the contact tracers can actually start to contact the people that are infected. So remember back when we first started this entire pandemic, we talked a lot about mitigation. We didn't have people trained, we didn't have enough people to do contact tracing, so we shut down the economy, stay-at-home orders, those types of things. Now we're back to that. We're even a higher level of new cases than we were before, and although we have more contact tracers now, I'm not sure they can keep up entirely with the volume of work that we're asking them to do. So I know the health department continues to train more people in contact tracing. I know people are interested in whether there are electronic means to potentially do contact tracing, but I don't think we can do enough yet to actually, contain the spread of this virus with 1,000 people a day testing positive.
With all the testing that we're doing now, are enough people being tested? Are the people who need to be tested, are they getting out there and being tested? Do we feel like, are there a lot of duplications of those numbers that we're seeing? Are they, a lot of people having tests and tests and tests?
So again, the questions about testing, are enough people getting tested, and are there duplications in testing? So remember, a positive test or a negative test tells you what you are that day. So if somebody is tested negative, it doesn't mean they couldn't be exposed a week later and need to get another test. So a lot of people get more than one test. That's common. And also in healthcare, particularly in the past when CDC made specific recommendations, if we had, for instance, a nurse that tested positive, we wouldn't let them come back to work in our healthcare center until they had 2 negative tests at least 24 hours apart. So you could see that the minimum number of tests that nurse would have would be 3 tests. So there are multiple tests done on some patients. But the health department only reports an individual once, regardless of how many tests that you've had. So they all, when they're reporting positive cases, once you have a positive test, you get reported once. You don't get reported again, even if, because we've seen patients that have positive tests for 4 to 6 weeks after their first positive test, even though we don't think they're infectious anymore. CDC backed off on the recommendations for repeat testing because of that known problem of some people, their test stays positive for weeks even though they're clinically well and they're not infectious anymore. So certainly anybody that has direct exposure to somebody, anybody that has symptoms should be tested. That would be the first priority. Of course, we test hospitalized patients, emergency room patients, and patients having elective surgery as much as we can.
Is it safe to travel now?
Well, that's a good question. So I think it depends on the mode of transport. I think let's take airline travel first. Airlines have done everything that I think they possibly can to try to make airplane cabins as safe as possible. But the reality is that if people are in the plane and if they take their mask off to eat or drink while they're on the flight, there is the possibility of droplets getting into the air. And yes, the airlines have changed their ventilation systems to try to filter the air better, but I will just tell you that that's almost impossible to do in that tight of a cabin space. So I think if you're going to fly or something, wear your mask and keep it on for the duration of the flight. That's the safest thing you can do. Certainly, I think traveling by car is safe. Just remember there's certain hot spots around the nation that you may want to avoid in terms of vacation destinations. So Florida's been obviously a huge hot spot in the United States, and I think you have to be very, very careful if you wanted to travel to Florida. We encourage that if you travel, you avoid areas of crowded, any areas that could be crowded. We actually, when our student athletes are coming back to Norman, encourage them to buy gas, but wipe off the handle of the gas pump, to take out food whenever possible rather than sitting inside of a restaurant, to avoid using very, very busy public bathrooms, but to use ones in less traveled or less frequently used places. And keep your mask on anytime you're outside of your vehicle, and certainly out in the crowds anywhere at all.
Okay, the last few days you had spoken at the beginning about the deaths. I think you said 14 deaths?
14 were reported today, 14 deaths.
This reporter's asking, do you see this number continuing to rise, and what could that be contributed to?
Yeah, so we have seen an increase in the number of deaths recently. If you look at the overall percentage, it remains low, but there have been more, individuals that have died recently. So it's attributed to 2 things. Again, it still is principally in the older age group. And as I mentioned earlier, even though the biggest majority of newly diagnosed cases are still in that younger age group, they're exposing other people. And in Oklahoma, we've been watching the rate of infection for those patients 65 and older going up, and they're clearly at more risk if they get the infection. The second thing is, right now, even today, there are more than 200 people that are in an intensive care unit in an Oklahoma hospital. And as I've highlighted before, you just don't have 200 people a day in an intensive care unit and not expect to see some deaths. If you get people that are that sick on a mechanical ventilator, historically we just know that there will be some deaths in that population.
Tell us about zinc. Is it effective in preventing the virus?
Yeah, so it's a real common question, is zinc effective? And I'd say the short answer is there's absolutely no proof at this point that zinc will prevent transmission of COVID-19. There are some really old studies looking at the common cold that suggested that if you took zinc, you might shorten the duration of the common cold, although those studies did not show that it prevents the common cold. But there are no well-done studies at this point looking at zinc that show that it will prevent you from getting COVID-19. So I don't have a problem if somebody wants to take it, but there is no proof that it will prevent COVID-19.
All right. This reporter wanted to talk a bit about testing, what we are seeing here, and what you're seeing across the state in terms of are there shortages in testing? Is it there's because so many people are getting tested now? Are we just having to schedule them so far out because of manpower, or is it because of things we're running out of? Or
yeah, so the question is testing. So around the state there are pockets that are having some challenges getting the needed reagents and other things to run the test. At the OU Medicine Laboratory right now, we're doing, I think our capacity has exceeded now about 1,200 tests a day, and we get the results within 24 hours. And right now we don't have any limitations with respect to reagents or other test materials, although it is difficult to get trained individuals that can actually run the tests. Some of the reference labs, particularly those that send testing out of state, have had some challenges, and some have had delays of 7 to 10 days. Looking at the MyHealth data, there are spots in the state where it looks like the delay from the day a test is taken to when the result comes out has gone out longer in some areas of the state, and that likely reflects either problems with personnel or the actual reagents that you need to run the test.
All right, this is a new one that just came in, so I haven't even had a chance to read it yet. It says, a reporter told this reporter that anyway, what does Dr. Bratzler think of some of the larger school districts' reopening plans? For instance, Broken Arrow just approved a return to in-person learning for the entire student body beginning August 19th. Masks are required for grades 3 and up, but it will not have discipline attached to students who don't mask. They are also basing their decisions only on the city's data, not the county's data, saying the communities through the county are vastly different. So.
This is one of the most difficult things I think is happening in Oklahoma right now is school reopening. So clearly there are parts of the state where the disease prevalence is much, much lower than it is in some of the urban or metropolitan areas of the state. And so I would just say in general, whatever you can do to reduce the number of people in a crowded circumstance, to physically distance students whenever possible. Certainly, I strongly encourage mandatory mask policy for school-age children because, again, masks help you reduce the spread of the disease. Many school districts are doing things like shutting down cafeterias, so having grab-and-go options for lunch that actually bring them into the classroom so the students can stay physically distanced but not into a large community setting. Kids get this disease. They don't get as sick usually, but they can definitely spread it to their adult parents or grandparents. And so I think all school districts need to be prepared and watch very, very closely whether they're having cases or not, because it definitely could spread to other people, the staff, students, parents, and others.
I think that is all the questions we have today. Is there anything that we didn't talk about that you feel like we need to wrap up with?
I don't think so. I think those are the key issues today. I'm watching the percent of tests that are positive, and good news is we've seen the last 2 days the daily average of cases start to trend off a little bit, perhaps we're headed the right direction again.
Everywhere I go, I feel like I'm seeing everybody complying with the masking, and I just even going down the street or going into buildings if I'm driving by, so I feel like we're on a positive note here now.
Yep, I see a lot more people wearing masks now, and so many businesses now require it that I think that's been helpful too.